More coronavirus vaccine alternatives and more groups of people who will be able to get their shots. And these are part of a slew of updated measures that have been announced by a task force to get more people vaccinated more quickly. Sherlyn joins us for more. Sherlyn, what are the latest updates on the vaccinations?
So private clinics will soon be allowed to bring in and administer WHO-approved vaccines, and that's under what the Health Ministry calls a special access route. Now, this includes those other than the mRNA vaccines like Pfizer and Moderna. Those are the only two currently available in Singapore's national vaccination program. And this move means that other types of COVID vaccines like AstraZeneca and Johnson & Johnson could soon be available, even though they're not yet authorized by the Health Sciences Authority here. Now, the task force says is to provide alternate options for people who cannot take mRNA vaccines, and that's due usually to medical reasons. But the Health Ministry will take lead from the WHO for vaccines that are approved under what it calls an emergency use list. Now, let's have a listen to what Minister Ong Ye Kung had to say.
There are only a handful of vaccines in the WHO EUL, as I mentioned earlier, is Pfizer-BioNTech, Moderna, the two which we are using for our national vaccination program. In addition, there is J&J, Johnson & Johnson, Sinopharm, and then AstraZeneca. Yeah. So, of course, there are many other applications before WHO now, one of which is the Sinovac vaccine. If WHO approves the Sinovac vaccine into the EUL, then a healthcare provider can apply to have access to use the 200,000 doses that we have and then use it to administer to individuals in our population who wants to have it.
Sherlyn, how different will this be then from the nationwide rollout?
Now, the task force has laid out that these new vaccine options will only be available via private healthcare providers, and they will not be free of charge, as the private clinics will be the ones pricing the cost of these vaccines. But for the nationwide rollout, on the other hand, it's only going to be Pfizer and Moderna for now, the status quo. But the task force will continue to explore such alternatives when it comes to this nationwide rollout, so that more residents will be able to get it in the future. Let's have a listen to them.
The Ministry of Health, as well as the expert committees, continue to look out for other promising vaccines that we may also bring into Singapore. Our approach is to provide a portfolio of different vaccines that meet our needs. And we do understand that there are individuals who are not able to receive the mRNA vaccine, even with a relaxation of rules. And we look towards procuring some of these vaccines that then can also receive HSA's PISA approval.
Sherlyn, I understand as well that the task force also reviewed some groups who couldn't take the Pfizer and Moderna vaccines before. What are their findings?
So there are good news for some groups of people, especially those who weren't allowed to get their shots previously due to medical reasons, such as pregnant women and breastfeeding mothers. But they will now be able to get the vaccines in addition to other people, such as cancer patients who are undergoing treatment. Now, they will soon be able to apply and get their vaccinations, but the task force has emphasized that they should still talk to the doctors first to assess the condition and see whether they are fit to get it. Now, all these updates are as a part of towards the nationwide goal of getting 2/3 of residents vaccinated, and the task force does hope that with these new updates, it can encourage more to go for them.
All right, many thanks. Sherlyn.